Hello, everyone. I am back with our fabulous speaker, Jill Meyer Lippert, from the program we did last month called Mouth Matters: Oral Health Before, During, and After Chemo Treatment. Now, there were so many questions submitted live with the registration that we couldn't get to them all. So, we have Jill back to answer some of those remaining questions in a special Q&A session that will go with the recording from last month's webinar. So, Jill, welcome back, and thank you so much for your willingness to address these remaining questions.
Oh, you're welcome, and I really appreciate the opportunity to do so.
And I also just want to give a special shout out to our partner, Unite for Her, because without them, I wouldn't have ever been introduced to Jill. So, shout out to our partner, Unite for Her. All right, Jill. So I decided to kind of categorize these, right? Like some of these are like systemic barriers, some of them are just like safety and timing within, our cancer treatments, etc. So I'll start with this. Um, we had a lot of people asking, like, how do you get these oral procedures covered? Because, sadly, with a lot of insurance that's tied to employment or, the Affordable Care Act. Dental is separate, which makes no sense, right? It's all health,
Exactly.
right? So, what are some ways that people can get oral procedures covered, or what are some like suggestions for them? Because I'll just read this quote from a previous attendee. They're saying, my teeth and jaw are now decaying due to being denied services. It's embarrassing to have to smile, and that saddens me.
Oh, it does me too, so much. And it's far too common that you hear of these issues. So I do have some general suggestions of things to check into. Number one, if you live anywhere near a dental or dental hygiene program, a school, that is an option that typically if you have treatment done at a school where you have a student that is learning the craft, is going to take longer. It will not cost nearly as much. You just have to be able to invest the time. And that can be really scary for people sometimes to think, oh, I don't know if I want to see a student. However, um, they are monitored throughout the whole process and typically have little checkpoints that they have to have instructors looking at all the way down the line to make sure things are done properly and they're done well. So that is an option. There are many cities that have like community health centers that do include dental services. So if finances are an issue, you can check if you may qualify for that. And like you mentioned, having dental separate from medical insurance is crazy. The same as eye
Right.
care. Like they're somehow not connected to the rest of the body. But I was actually really excited for this question to come up, and the timing could not be more perfect because I will refer back to my website quite a bit just because when I find new resources that I think are valuable for people, I will put posts about them on there so people have easy access to them whenever they need them. And just this last week, I added a post. I have it in the patient resources tab, and I also have it's currently the top article in the patient blog section. It's from a dental hygienist that I know that she has her own company that teaches dental offices how to bill medical insurance to get reimbursement for dental care and especially for damage that they can document was caused by cancer care or cancer therapies.
Whoa, that
Yeah.
is huge.
Yeah, so she really helped me out recently where I had a breast cancer survivor reach out to me with a similar situation. She said, I have medical insurance. She said, I actually have really good medical insurance. I have dental insurance, but the amount of work that I need done does the dental insurance doesn't even put a dent into it. And that is it. I've been in dentistry now since the early 90s, and I can tell you that most dental insurances have not raised your yearly max since then. So they're still going a lot of times at like $1,000 of a yearly max, which is not much, especially if you need extensive work. So she helped me out to try to help this survivor to find an office that could help to bill medical for her. And so I got to sit in the background and kind of third party observe their conversation back and forth just to help me learn more. And I had encouraged, her name is Kendra Sellers, and she is very passionate about it because her sister actually had cancer as well. And this is a subject that actually is near and dear to her heart as well. So she created a directory on her website now that patients can go to, and you can find a dentist in your area or somewhere close, hopefully, that has had training through her on billing medical insurance for reimbursements. So that is an exciting resource that really may be a benefit for a lot of people.
Oh my goodness. And do not worry, everyone. We will be linking to that. Do not worry. We will be sharing that information. Oh my gosh. Super
Yep. And
exciting.
I'd like to add that's actually for anybody who's newly diagnosed, that is one of the really great benefits of getting in early and seeing a dentist before your treatments, because you have the documentation then. You can see exactly what was your oral condition before going into treatments compared to after. And that can really be helpful for coverage purposes.
So, I mean, I do have to ask, what about those that are already, mid-treatment or now in survivorship and, now are seeing some of that damage? Would we still be eligible for that, or does it make it more difficult?
Um, it may make it a little more difficult, but just depending on what the damage is, may make a difference for you. So I will just use, this will be an extreme example, but let's say somebody now that has had some of the medications that put them at risk for that osteonecrosis of the jaw,
Hmm.
you know, that's very well documented, as far as what medications that this person has had, and if they can make that link, then that is a direct result from that. So, you just need to have an office that, number one, is willing to put the time in to learn. Um, and I think if you have an office that you're seeing somebody that isn't, maybe that's your sign that maybe it's time to look around. And there's nothing wrong with that. I think sometimes, and I'm the same way, where I feel loyalty to everybody. And sometimes that goes to my detriment, where if I'm in a situation that maybe isn't the right fit, I try to give the benefit of the doubt. And in a situation like this, there's nothing wrong that if you don't feel that that provider is giving you a level of care that you need, um, there's nothing wrong with checking around to different providers and finding one that's a better fit for you.
I absolutely agree. As my maternal grandmother, my Nana always said, she was a registered nurse. She's like, it's your patient right to change doctors if you do not feel comfortable or if you want to, see, hey, maybe I could get better treatment or get second opinions, etc. So just always know it's your patient right to change doctors because at the end of the day, it's your health and you matter.
Yeah, you have to be your biggest advocate.
100. So, you, I love that you mentioned this because we've had questions about, specifically trained dentists for like cancer patients. Like, when is it safe to visit a dentist? Because, some of these questions here, should we see, ideally before we have any
Mhm.
type of chemotherapy or radiation, because I know for me, when I had radiation, the burns and things, the beam shot up on the side of my neck as well, which indeed also affected the mouth. And like, what do you recommend, or what should people be thinking of in trying to find a specially trained dentist, or if they don't know of one, what are some questions that they could ask the dentist?
And I know we touched a little bit on this the last time, and it's a tricky subject for sure, because that isn't something that we tend to learn a lot about in dental hygiene school, dental school. So again, it really does take a provider that is willing to put that extra time into into learning and understanding the importance. I can't tell you I've had more than a few times when I've given a presentation to a group of dentists or dental providers, and after the presentation, one of the attendees would come up and say, "Wow, that was really interesting. Someday, if I ever have somebody that had cancer," and I'm thinking, you probably have somebody that is a cancer survivor in your practice every single week.
Right.
And he just was not putting those puzzle pieces together that maybe some of their issues could have been a result. And I still just look, I mean, I laughed and I wanted to cry at the same time when that happened. But number one, having somebody that understands, appreciates the struggles that people face after a diagnosis, not understanding that just because treatments end, the problems don't necessarily end with it, and be willing to invest that time. And there are so many resources. I mean, there is the National Network for Healthcare Hygienists. They have an oncology program that at first was open mainly to hygienists, but dentists or any dental provider can take that as well. Dentists can. There is the International Society of Oral Oncology. There's an American Academy of Oral Medicine. There's so many different organizations out there that can give you advanced knowledge if you are willing to put the time into it and appreciate the need for it. So that would be something that it would not be a bad idea to ask if they have any extra training in it. There's nothing wrong with even providing, "Hey, I heard these organizations are out there. Is this something you would consider doing to know that you're helping your survivors as much as possible?" And feel free, I'm just going to say my website as well. That was one of the things is I understand on the provider side as well. There's so much for them. I never want to say anything bad about somebody that doesn't take those extra steps, because a lot of them feel like they're just struggling to stay up on everything because there's always changes. There's so much that they're dealing with. So that is one of the reasons when I created the provider side, is to try to condense some of those resources and make it easier for them to find. So even if they're not going through a formal program, if they can utilize something like side effect support, they can gather some of this information, enhance their knowledge, and not have to spend all the time and the effort into trying to search it out.
That's great advice. Great advice. So another question that we had about like root canals, extractions, like are those safe while, your white blood cell count is low or red blood cell count? Like how do you, I guess the question really is, how do you know when it is safe to have like extractions and root canals, whether you're, you know, in the midst of treatment or post-treatment? Like, how do you know?
Um,
Was there a window?
Kind of. Yeah, so as I'm sure anybody that has chemo knows, it's that roller coaster effect where you have your infusion, and then by about 7 to 10 days after is when all of a sudden your blood counts probably hit their bottom levels. That's when mouth sores are more going to be likely to occur. And then it slowly starts getting better just to the time that you probably are feeling a little bit normal again, and you're right in time for that next visit again, and you keep going in cycles like that. So if you are in mid-treatment, sometimes your oncology team can, through good communication with your dental providers, let you know those safer windows when your blood counts are going to be at their peak. And then it's the safest time to have your treatment. So you can have like windows of time that it's going to be safer. As far as if you have to have a root canal, you have to have an extraction because you have active infection. That's tricky because we don't want active infection to be in there with low blood counts, because then it's a risk that it could spread from your mouth, it could go into your bloodstream, that could be
Oh,
a reason for sepsis.
oh,
So we need to, yes, there's no reason in the world that an infection in your mouth will stay contained there. That can spread to your heart, it can spread to your brain, it can go into your bloodstream and be a reason that somebody does not get through. So we need to take any infection in your mouth very seriously. However, we need to kind of balance those risks and benefits. So we need to probably, if somebody has an active infection in their mouth and their blood counts are really low, they're probably going to work with some antibiotics, antimicrobials to get it at least calm down until we can get those blood counts back up to a safer level and then do the treatment. So
Mm.
it's a fine line with that where you really need to not leave infection, but you have to make sure those blood counts are safe in the process.
Again, it's that patient-doctor relationship and
Mhm.
communication. So don't be afraid to, tell your oncologist, these concerns. And if you do have a dentist, like it's so important that your whole care team communicates with each
Yes.
other. Yeah,
Yes, and that is very lacking in general. Unless you
right.
have a dental team that is part of the hospital system that you're at, a lot of times there's a lack of communication there.
Mm, gotta do better, right?
Oh, well,
So
actually, if you don't mind, I'll mention one more thing. I have a
yes.
communication sheet on my site as well. So if you go to the professional resources tab, we have two items on there. It is a communication checklist that can be used by the dental team as far as information to gather from the oncology team. And the oncology team can use that as well as to say, what do I need to let the dentist know? But then they're also, we created a companion guide that goes with it that is more detailed to split up pre-treatment, mid-treatment, and post-treatment considerations with that. So they can be used together to help guide your dental care to make sure that it's done in a safe manner and efficiently for you.
I mean, talk about a wealth of very needed and specific information. Give out the your website name again.
Sure, it's a sideeffectsupport.com.
Okay. And don't worry, all again, we will definitely be linking to it. But I was like, let's just say it right now. Oh my goodness. So let's again talk about that like dry mouth and how do we explain that to our care team? So I'm going to give you an example. I remember going through chemo, and I did have dry mouth, and then I did get like the mouth sores. And I remember being scared to tell my oncologist this because I was like, I know I need this chemo and I don't want to be kicked off of it because I had a very large tumor in my breast. I knew I needed to stay on it. And honestly, if it had not been for the oncology pharmacist, and I want to give a shout out to pharmacists because I think often we forget about a great role that they play in all of this too. And her name is Candace. I'll never forget it. And she asked me, "How are you doing?" And I mean, I could like barely talk and everything hurt. Even my teeth hurt. And I was like, I'm okay. And then she just like stopped and looked right at me and goes, No, how are you doing? And I just like burst into tears. I was like, I don't understand what's happening. It's hard to swallow. And, and some have some other questions on here too, like they've noticed like increase in saliva, or the beginning of mouth sores. And so I know for me, she just happened to mention she was like, "Have you ever heard of Joe Claire?" And I'm like, "Well, it sounds like something I would take because my name is Megan Claire." I was like, "Doesn't that sound fitting?" I was like, "Did they name it after me?" But no, but if I had not had that conversation, if she had not like looked at me and said, I've got something that can help you. And it turned
Mhm.
out to be one of the main reasons why I was really able to continue on with my chemo treatments. Can you kind of talk about like what is going on in the mouth? Why does chemo or radiation or any other type of treatments like affect the mouth like that?
Oh, that's a great question. So it really comes down to understanding what cancer is. Every cell in our body goes through that division process where it divides and it replicates and it makes new versions of itself. And then the original cell will die a pre-programmed death called apoptosis. So little science backing here, but so in that process, you have that cell division. What happens with cancer sometimes is you can get uncontrolled cell division. all of a sudden those cells will just start multiplying and dividing without control. Like the immune system isn't detecting that there's a problem there. So it evades the immune system and then it can start to invade other tissues. So that's actually what cancer is. It's this uncontrollable cell division. So there are certain other cells in our body that just by nature, they have kind of a more rapid turnover, including the epithelial lining in our mouth, our blood cells, our hair cells. And that's the reason, like with chemo, radiation, things like that, you're getting cell death. And oftentimes with the chemicals, they're targeting cells that have a rapid turnover. So that's not what they're wanting to go after, but they end up being a casualty of war in the situation. So that's oftentimes where the cells in the salivary glands are affected. They're being damaged in the process. The lining of the mouth, those cells are being damaged. The blood cells, that's why you get those low blood counts. That's why people lose hair. So that's a lot of the times why the mouth is more affected. And I know I mentioned this in my slide program, that so often patients, providers just assume that dry mouth is just, it's a nuisance. It's just like, oh, it's just uncomfortable, but you'll be fine. But your saliva is amazing. Your saliva has so many healing properties and anti viral and antifungal and antibacterial properties. And it helps to balance the pH of the mouth. It has so many great things that it does to help be protective. So when you have a reduction in saliva, you lose all those benefits. That's what makes a dry mouth more susceptible to cavities, to gum disease, to getting mouth sores, to other types of infections in your mouth, even like getting thrush and problems like that. So the more that you can treat that dry mouth, the more protective that you can be. So, and that's where you can actually help reduce getting mouth sores by using lots of oil moisturizers and things like that too. So you can sometimes do really simple things with that. There's so many over-the-counter dry mouth products that are out there, and dry mouth so common with even over-the-counter products, and we have an aging population in general. So there's just more and more products coming out because manufacturers are understanding there's a big need for this. It's just a matter of doing some investigating to make sure that you're using a product that is not acidic, because unfortunately that's too common, that a dry mouth product may have a low acidity level, and then, or I should say, yeah, a low pH, which is very acidic, and that can be damaging to your teeth as well. So you want to have something that's not only going to just mask the problem, and then end up causing more problems down the line in survivorship. So that's where having a good relationship, again, with your dental provider, asking questions about that, even with your medical provider, your dental provider, that if they say, hey, I think this would be a great product for you to use, that's a good question to ask. Well, is this acidic at all? Is this going to potentially cause damage to my teeth in the long run? And if they don't know, that's a great motivation for them to find out.
So, what are some, I guess, natural ways that we can add that like moisturizer in our mouth?
Some people like to use like coconut oil. Some people even like olive oil, things like that. Some of those natural healthy oils can be soothing at times and have some antibacterial effects to them as well. I know some people like they call it like oil pulling. And I've read things both ways of how beneficial it is at all, but there's nothing, like if you find that olive oil is soothing to your tissue and it helps reduce the dry mouth, it won't hurt you. So that's, I mean, a nice inexpensive thing to do that's all natural, and a lot of people have it readily available.
Hmm. Okay. So when you have the um, mouth issues, right, and say long-term dry mouth, and often this uh, can happen while being on aromatase inhibitors. What do you do with that? How can you help manage that? And maybe can you mention like what are some, typical issues that could happen while taking AIs in the mouth?
So, and I'm glad this question came up again because I know there was a question last time and
Mhm.
I got done and I'm like, oh, I wish I felt I could answer that better. So if you think of, the effects that an aromatase inhibitor has, it's reducing those hormones.
Mhm.
So it gives you a lot of those same effects that you're getting through going through menopause. And if you think of what those are, it's a lot of dry mouth that can come with that. And it's just like all sorts of things get drier. And then and then even bone mineral density. When we talked about that there is a bone that holds all your teeth in the jaw. And when you start losing that bone mineral density, that can affect that as well. So we just need to be, number one, aware that it does make you more susceptible to having issues as far as more susceptible to cavities, gum disease, and things like that. It doesn't mean it's hopeless for you. It just means you probably really need to stay on top of it. Really good home care, staying on top of your regular dental visits, and then using products that help to add moisture to the mouth effectively and be protective. And there's a lot of products out on the market, well, that you can even get through your dental appointment too, or your dental professionals that help to keep your teeth strong. So whether that be working with fluorides, there's what's something on the market now called the nanohydroxyapatites. There are products that have arginine in them that act like a prebiotic that help to feed the good bacteria in your mouth. There are probiotics. There's actually little lozenges that you can suck on that help to just the same as you take like a probiotic when you for your gut health. There's little
Mhm.
lozenges you can suck on that help to add good bacteria back into your mouth, and they're more specific to your mouth. Um, yeah, there's a variety of little things you can do like that, but it takes you to kind of do a few things to really, I think, see the best benefit with it.
Gotcha. Gotcha. You know, what about like the dry and cracks at the corner of your lips? Now, I know some of that is due to like being dehydrated.
Mhm.
And that is something that I've also had to deal with because it's kind of almost a trauma response of you have to drink so much water when you're going through chemo. And it's like, now I don't like water. But I have even noticed sometimes I get these cracks on the side of my mouth here. Why does that happen?
Well, one thing that I thought of with this is if you're in treatments and this happens and your blood counts are low, make sure that you ask the doctor about that because it could be a condition called angular cheilitis, which is actually a little fungal infection that can happen around the corners of your mouth. So if your blood counts are real low, you do become more susceptible to any types of infections. So that could be a possibility. So you don't want that fungal infection to be lingering around there. They can give little topical creams for that, or sometimes depending on the severity, or if there's a thrush that goes along with it, they may give you some type of a systemic antifungal to help combat that. So that was one thing that I thought was the most important to double check. If they don't feel that's the case, it is keeping them well moisturized, making sure that you don't lick your lips a lot. I think that
Mhm.
tends to be a natural response. They're dry. We want to lick them. But then when that saliva dries on there, it just makes them that much drier. So you don't want to lick your lips. And then I personally, and you will have somebody that will tell you the exact opposite, but I like to avoid petroleum products. I don't like to put
What?
Vaseline
No
on,
Vaseline?
and you're going to have other people that say put Vaseline on, but again, I do think there's a value in staying with more natural type of products. And again, you can use coconut oil, you can use the aloe vera type things. There's a lot of non-petroleum lip balms that are
Hmm.
available on the market. I would avoid ones that have like menthol and things like that. All of those things can make you, again, feel like you have that immediate relief, but then in the end, kind of keep your lips drier in the long run. And it makes you kind of dependent on it. You'll see that sometimes where people like, they're with, I don't want to say, I want to say Carmex, that's the one that comes to my mind, that people are constantly, putting their Carmex on and just can't seem to get enough of it. And sometimes there's certain products that just, they're going to make it drier in the long run. So it keeps you dependent on them.
I'm like, was Jill spying on me earlier? Where I was putting on my chapstick before I put on my lipstick. Oh
I
my
would say
goodness.
too, just be conscious that you're not breathing through your mouth as well.
Mm,
Concentrate
yeah.
on the nasal breathing and also checking when you're sleeping. If you are a mouth breather while you're sleeping, if you have any obstructive sleep apnea, you're a snorer, you can do a lot of these things during the day. And while you're sleeping, you may be sleeping with your mouth hanging open because that's how you breathe. So sometimes there's ways too that everything's connected, that if you deal with a sleep apnea, sleep breathing disruptions, that can help to keep your mouth more moist, your lips more moist, protect you in those ways too.
My goodness. Oh, so is does tartar increase? Is that a common side effect of chemo? Because the example that was given by an attendee from the webinar last month was I floss and brush, but tartar is worse since turning 60 and chemo. Is there
A
any
lot
truth
of
to
that will
that?
have to do, I wouldn't say it's a general rule by any means, but it has a lot to do with your own body chemistry and your personal oral microbiome. So when we
Mm,
talked in the slides about how we have, over 700 species of bacteria and fungi and viruses that live in our mouths, our constant battle is to have the healthy ones, the ones that are actually beneficial for us, to outnumber the harmful ones. And sometimes through dry mouth, different medications, stress, menopause, all these different things can kind of form a perfect storm that gets that oral microbiome kind of out of whack in there. So I'll just say there's one thing I have on my site as well that is it's actually a microbiome test. It's something that people can use at home. It's you actually collect a little saliva, send
uh-huh.
it in, and they will analyze your personal oral microbiome and send you back a full report. And it splits it up into like cavity risk, gum inflammation, bad breath. Even it will list out like your percentage of like healthy bacteria in there. And then it can give you personalized recommendations of things that you can do to help improve that. So that's a really cool thing. And this particular company that I partnered with that, they have a hygienist that I know that's awesome. She is their hygiene consultant. So she can work with people that have these tests done and do one-on-one counseling with them as far as product recommendations, home care techniques, all those different things to help them turn that whole situation around.
I mean, my mind just continues to be blown. Wow, wow. Um, so another question is, this person says that they lost most of their molars since their ovarian cancer diagnosis 16 years ago with 6 recurrences. Oh my gosh, we're so happy you're still here.
Yeah.
Is that typical? With whether it be ovarian cancer or any type of cancer?
Can't say it's typical or expected, but I can't say it's unheard of either, but again, a lot is really individual to that person's situation. What was their oral health like before going in to treatments, which really does play a big role. Part of the presentation I had was the tooth anatomy and looking at how it's kind of like in layers, like a peanut M&M. Well, if you think of every time a cavity starts and they have to put a filling in, you're removing some of that tooth structure and you're putting a filling in that area. Now, if you get another cavity around that area, and all of a sudden you have another filling, and then you have another filling, and then you run out of space, so they have to do a crown, and then it can snowball for people that the
Mm.
more treatment that you have done on a tooth, the harder it is to you can't just like patch eventually. It's going to get weak. You're going to risk breaking. And for somebody that's had 6 recurrences, I am sure that there's just been a long struggle with a lot of dry mouth,
Mm-hmm.
really a struggle with having that oral microbiome getting unhealthy. There's probably stress. There could have been a lot of clenching or grinding of the teeth or something like that. I'm somebody that when I get stressed, I take it out in my jaw, and which is not an uncommon thing. So for people that do that too, that's putting extra pressure. And if there's a lot of fillings, those teeth are weaker. So it would really take, it's really a generalization that is about as good as I can give, because it would really be
Mm-hmm.
taking that particular person's dental history, their x-rays, and looking at what their situation was to give them a better idea exactly why that all happened.
Wow. Wow. Let's see. So again, kind of going along with that, does that this person says that they had cracked 2 teeth during and then after chemo, both resulting in crowns. And that person's like, is that from the chemo? What can I do to protect my teeth now? So is it kind of similar to how you just responded to that previous question as
Yeah.
well? Hmm.
Definitely. It's very individual. I would, for that particular person too, I would have them monitor themselves for any clenching or grinding, check for any tenderness in their jaw, if they've had any clenching or like clicking or popping in their jaw. And one of the things I mentioned during the program too is that for people who take certain types of antidepressants, anti-anxieties that are called selective serotonin reuptake inhibitors,
Hmm.
that class of drugs can have a very unique side effect, or they can make somebody more susceptible to clenching or grinding their teeth. So sometimes, I know what a weird thing for
I
a
know. I'm like,
medication to possibly,
what?
yeah. So sometimes too is kind of analyzing, could that be a side effect? If somebody notices that they're doing that a lot, um, asking your provider, could this be a side effect from some of my medications? Or Google's a great thing. I know providers don't always like that when when you Google things, but to me, I think knowledge is just power. So there's nothing wrong with asking. And if that is a side effect for a treatment or this medication that you're having, um, it never hurts to just ask, is there an alternative that you feel would work just as well that maybe doesn't have that side effect? And I'd say that the same thing with dry mouth or anything else. If you're struggling with a side effect of something, it's good for a conversation just to see if there's an alternative.
Right, because something I think about too, is when recognizing, oh, what's different? Like what's different
Mhm.
that I added, either to my medications or, change of habits, etc. When I start to get like a side effect, I'm like, wait a minute, where did this come from? And then it's like, oh, let me ask that question. So
Mhm.
just want to make sure we're saying like, because many of us do end up on taking some sort of antidepressants to help with anxiety or depression, and that is okay. That is your
Absolutely.
buffer, as I like to say. But if you are noticing, side effects that you may be like, I have no idea if this is related. As Jill said, it does not hurt to ask the question and, write stuff down so you don't forget, because some of that chemo brain or brain fog can still follow us even many, many years later. So it's just so important to keep that conversation going.
And I think if somebody does notice that they're clenching or grinding, there's mouth guards that you can have made. That you can have impressions taken of your teeth. You can have customized mouth guards made,
Hmm.
something that you can maybe put in overnight, because that's the hardest time to control yourself when you're doing it. And just give your teeth a little bit of a cushion in there and be protective. And sometimes those mouth guards are things that you can um, have multiple uses for. So they're not going to only protect your teeth as far as the pressure, but that sometimes you can maybe put like a fluoride or remineralizing agent in there to, sit on your teeth a little longer and then help keep them stronger.
That's great. And we're getting closer here to the end, but some questions about that, right? Like some night maintenance, because someone also wanted you to talk about Invisalign. Is that kind of like the same idea as with the mouth guard for night maintenance?
My main experience with Invisalign is mainly for straightening teeth or positioning of teeth. So
Hmm.
I am a big fan of orthodontics, huge fan of orthodontics. I think, the more aligned your teeth are in, the more aligned your jaw is in, the easier it is to keep them clean. It actually helps with breathing issues sometimes if people have like a malpositioned teeth or malpositioned jaw that can affect your breathing at times.
Hmm.
So orthodontics is great. I don't think, and I guess I'll just say I don't have a lot of experience with that. I don't think Invisalign is really meant for like utilizing as like a fluoride tray or anything like that.
Hmm.
However, it probably can be a bit of a buffer, if you're a cruncher or grinder. And I think one of the questions, sorry, I hope I'm not jumping ahead here, was like maintenance of, I wasn't sure actually when I read the question, were they talking about maintenance of the Invisalign or maintenance? So I did look up to that. I know on the Invisalign site, they have a full store on there of ways that you can maintain your Invisalign is the trays themselves. So they've got special like cleaners and they've even got like a little ultrasonic shaker and things you can use to keep that clean. Because anything that you put in your mouth, whether it be a retainer, an Invisalign, a night guard, things like that, you want to make sure that those stay really nice and clean too, that you're not introducing bacteria back in every time that you put those in.
And, want to remind everybody to definitely make sure that you are watching the program that Jill did because she also did a demonstration on even flossing and the way to like hold and floss your teeth. Like that was such a big impression of doing like the seed. Like I was like, okay. So just want to make sure, yes, everyone, that was a really good demonstration there. Um, so. This question here. I mean, when we are diagnosed with cancer, whatever type of cancer that is, we are just inundated with information, and then there's such a fear that we're going to end up doing something wrong that causes more harm, etc. So, someone asked, do you have a sheet, a downloadable, or something for family members or friends about not putting toothbrushes in the same holder? Because I could tell that like surprised people of not keeping your toothbrushes together. And they were like, this is amazing info, but oh my gosh, it's exhausting having to keep explaining seemingly simple things to people.
Right. So on my website, there is a downloadable patient brochure. You can go under resources, and this is the adult one. It's available in English and in Spanish. And I also have a pediatric one that's available in English and Spanish. But in the adult one, there is a toothbrush section, and it just says to use an extra soft compact head toothbrush or use an extra soft toothbrush with a small compact head. Soften bristles under hot water if needed. So if you have a toothbrush that the bristles still feel a little stiff, if you run them under real hot water, that will help to soften them up a little bit. And then I put replace brush after the first sign of bending or fraying of the bristles. And then protect toothbrush from germs. Do not store near toilet or touching family members' brushes. So that's right in the middle part there.
I mean, I just think all the time, like even, growing up, like it's toothbrushes are all
Right.
together in the little toothbrush holder. So,
I'll show you one thing too. This is something that I have on my site. It's called an Intelligent Toothbrush Shield, and
okay.
it's a moisture wicking fabric shield that can just slip over the top of the toothbrush, and it helps the toothbrush to dry,
Mhm.
but then it also protects it from cross-contamination. So even if you did have it in a holder, or whatever is touching, if you keep yours separate, this is a protective shield for it. We actually have some hospital systems that will use this to help prevent the toothbrushes from being an infection source for patients. Because you think of, if you're inpatient, there's a lot of germs in the hospital, so this
Right.
is one way to protect your toothbrush. It's disposable, so it can sit on for up to 7 days, but they do recommend if somebody has an illness or, if your immune system's real compromised, even every 3 to 4 days, you just toss it, put a new one on, and it helps to reduce the bacterial buildup on your bristles.
Get out. Get out. My goodness. So kind of going along with that, are
Mhm.
UV sanitizers for toothbrushes effective?
That is something too that I always feel like I'm not as knowledgeable in as I wish I was.
Hmm.
And I think it depends probably on the particular, just like anything, it would be a general statement versus I'd have to really look at each particular model and what type of evidence that they have behind them. So I'll just compare it to this where and it's a completely different subject, but so I also work with Waterpik. One of the things that I do is I travel around Northeast Wisconsin to dental offices and I do programs, lunch and learns for the teams, and I talk about water picks. Well, there's a lot of water flossers out in the market. Just because there's a water flow does not mean it's just as effective. So that is one thing we talk about is the studies when they compare the water pick compared to some of the other brands and the difference in plaque reduction, the difference in bleeding reduction and inflammation. Um, you can see that just because they both squirt water, there's differences in them. And I would say the UV sanitizers would be, right at that same level.
Hmm. That makes sense. So, we're getting to our last few questions here. Are steel posts safe for cancer survivors? What is that?
I'm guessing they're probably talking about implants,
Oh,
dental
okay.
implants.
Okay.
Implants are made out of titanium.
Oh,
And those are what they call like biocompatible with bone. So that is something that your bone will actually form around. It won't it tends not to reject it. So that is something that in general, as long as you are out of treatments and you're not in a situation where your counts are compromised, that can be safe. However, if you are at risk for the osteonecrosis of the jaw, that is another story. And whether that be from radiation or from medications, that is a situation where implants may not be.
mm, mm. So I mean that kind of goes again with the next question of is it safe to have implants placed? And I'm assuming that would be like after your treatments would be over?
Right. And the same, applies when I mentioned if the treatments are over, it all depends on what your specific treatments were.
Mm-hmm.
Some of those bone building medications can stay in your system for a long time. So just because, even if you stop taking them for whatever reason, that has to be if you're having treatment like that done, it has to be with somebody very knowledgeable and in coordination where you would need to have somebody that um, has good communication with your oncology team, that they understand what your meds were, what the risks are. They're working with, probably an oral surgeon who
Mm-hmm.
has more specialized training with things like this, because osteonecrosis is it's a tough condition. We need to always look at being as preventive as possible, and the vast majority of cases are caused by some type of a trauma to the bone, such
Mm.
as an extraction or placing an implant or something like that. So we have to be careful and coordinated with treatment for people that are at risk.
And let's see. So in talking about that osteonecrosis, can you just like give like the definition of that? Because
Sure.
I know what fat necrosis is, because I experienced that when I had invasive lobular breast cancer. But can you kind of talk about that and I guess the kind of damage that can do to the jaw?
Sure. So I always feel hesitant to say what the meaning of it is because once you break it down, um, osteo is bone, necrosis is death. So it is death of the jawbone, basically. So um, our the bone in our jaw is very vascular. It has a lot of blood vessels. And what can happen when we take some of those bone building medications is that we start building bone really rapidly, and it doesn't develop that same vascularity that healthy bone would develop. So
Hmm.
then if it experiences some type of trauma, it doesn't have the same healing abilities as well. So osteonecrosis is when you start getting that infection, death of the jawbone, and things we're going to look for with that is sometimes like a feeling of soreness, heaviness in the jaw. A lot of times we're looking for exposed bone. So all of a sudden, you would maybe feel like a little area that feels like bone kind of sticking through the gum tissue, a loosening of teeth, a drainage, things like that. It could have a variety of symptoms with it. The biggest thing with that is and I never want to say things that is scary for people because again, the risk is low, but it's there. And I think it's our responsibility that we let people know, give them as much information that empowers you to do what you need to do to prevent it from happening. Um,
Yes.
I could tell you my first experience with seeing osteonecrosis is something I will never forget. And it was a situation where a lot of these medications were very new, and it was used in an elderly man that was a patient at our office that had multiple myeloma.
Mm.
And the oncologist called us up and said, "We're not really sure what's happening here. Can you look?" And I will remember that because he was a very, very advanced. And the hardest part is he was never told that was a risk.
Oh.
Um, and I think that's what hit me is because I I knew him long enough. He wasn't going to do what he needed to do anyway, just through history. However, he should not have been denied that ability to make that decision on his own. So again, keeping your teeth just as clean as possible, being as gentle as possible, really staying diligent on your preventive care, doing everything that you can do to keep your teeth healthy and your gums healthy is the best gift you can give yourself with that, because we just want to prevent you from being in a situation of needing an extraction. And if it comes down that you break a tooth or something like that, and they can save it with a crown or root canal and things like that, that's going to be your best option versus, taking it out might be less expensive, but it's going to
Hmm.
come along with a lot more risks.
Well, Jill, I cannot thank you enough for coming back to answer these questions. The webinar that you did for us last month was so hugely impactful. And, this topic is just not discussed enough. And I feel, I know our cancer community here at Share is very, very thankful that you've taken the time to share with us all of this information. And again, we will be linking to your website. And, I really love what you just said about we don't want to scare patients. We often hear that like from our oncologists and other care team members, but it's like you just said, just let us know what could potentially happen. So at least I can have some information, not saying it will, but then if it does, then we could be empowered to do
Mm,
something and make different choices versus if we had no clue about any of it.
right. I agree. And thank you. I really appreciate the opportunity to speak with you all and spend time with you, Megan.
All right, everybody. Thank you so much. Make sure to check out the link, share it with everyone. There's a lot of great information both in the webinar, within this Q&A, and also on Jill's website. Thanks, everybody.